Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCray.
Can mentally stimulating activities reduce the risk of cognitive impairment as we age? Well, another way to say that is, can games, crafts, and using a computer really decrease your risk of getting senile as you get older?
Well, maybe. Joining us by telephone from Mayo Clinic in Arizona is psychiatrist and behavioral neurologist Dr. Yonas Geda. Welcome to the program, Dr. Geda. It's nice to have you with us.
Thank you. Nice to be here.
Yeah, thanks for joining us, Dr. Geda. So that we all understand the terminology, first define cognitive impairment and then mild cognitive impairment for us.
Thank you. Maybe let me start with mild cognitive impairment. Mayo Clinic actually is the leading institution that developed this concept and validated it. So Dr. Ronald Peterson is really the lead investigator in this area. So what was being studied in the late 80s in Rochester, Minnesota was dementia and normal aging. Then researchers started to observe that there are elderly persons who are neither demented nor cognitively normal. So they are in the gray zone. So they could be forgetful for recent events and future engagements. When we say forgetful, it's not like misplacing car key. I'm talking forgetting that a person has a flight from Rochester to New York City, forgetting a critically important information communicated by telephone, or repeating oneself again and again. So they started, Dr. Peterson and colleagues started to observe these types of individuals, and then they said, well, let us investigate this. And then they came up with a criteria. Mild cognitive impairment means forgetfulness for recent events and future engagements. And when the person is tested, the problem could be in one or two areas of cognitive problem. Overall intelligence and other things are normal on testing, and the person is functioning independently. That's very important to distinguish it from dementia. So that is defined as mild cognitive impairment. Whereas cognitive impairment in general is a big set. So that is a set. Under cognitive impairment, we have mild cognitive impairment, we have dementia, we have different things. So the bigger umbrella term is cognitive impairment, whereas within that there are specific types of cognitive impairment. I hope this answers your question.
Well, it does, but also tell us, is this the same thing as what we used to call senility?
Senility, it can be interpreted as some sort of memory problem that is manifesting as normal aging. It could be that one. But I think I would say I don't think the word senility directly translates into mild cognitive impairment.
Okay.
Tell us about the study.
All of these terms that you have just talked about, none of us want to have that. So how can we help ourselves?
Yeah, what did you learn through that study?
So we really asked very simple questions. The question we asked, are there some mental activities that are accessible to everyone? For example, in persons above age 70 that live in Olmsted County, Minnesota, when do some of them engage in craft activities? Do they have group activity, for example, Bible study as a group? Do they engage in social activities like going to a museum, going to movie, and socializing, meeting? How about reading books? And how about using computers? So we looked at these types of simple things that do not cost us money. And then we said, okay, engaging in these activities, do they decrease the risk of mild cognitive impairment or dementia? And we were, I have to say, we were pleasantly surprised that several of these simple mental activities decrease the risk of mild cognitive impairment or MCI if a person engaged in those activities at least 3 or 4 times per week. So I want to remind you that before the mental activities, we have also done physical activities study. We also asked the same question. If let's say I'm 75 years old, retired, after a dinner, if I go for a leisurely walk in my neighborhood, would that decrease my risk of MCI, mild cognitive impairment? And we observed that even leisurely walk, when carried out 3 or more times a week, was associated with decreased risk of mild cognitive impairment. Therefore, it seems like all the roads lead to Rome. Engaging in mental activities and some degree of physical activity seem to decrease the risk of MCI.
And which was better?
Actually, this was our curiosity as well. So I think that when you look at this, we measure decreased risk using different quantities, relative risk, etc. They're very similar, really. And how about combining the two? Some people call that, one of the students called it, how about the combo? The combining the two seem to be even a little better. So we have done that study a few years ago, and I think it is very comparable, both mental activities and physical activity. I think doing both seem to be even better.
What about social activities?
Yeah, we took social activities under mental activities. We included that, and social activities was also associated with decreased risk of MCI.
And I think you studied some 2,000 people, didn't you?
Yes. So these are residents of Olmsted County. The study, the umbrella study is called Mayo Clinic Study of Aging. The lead investigator is Dr. Peterson. And within that study, we took 2,000 persons, 70 years and older. And in 2006, or around that time, we collected information about mental activities and physical activities.
So what qualifies as a mentally stimulating activity?
We defined them as reading books, using computers, social activities. We found this questionnaire, which is validated questionnaire, used by other groups, and one of our colleagues, Dr. Knapman, introduced it to our team, and we used that. It is a validated questionnaire, so it is listed. So these are reading books and computer use, social activities, group activities. All these are defined as mental activities.
And what about future research?
So the direction of our future research, what we are looking at this point in time is whether there is a genetic risk called ApoE4 it increases the risk of Alzheimer's disease if a person is engaging in physical activities, and still if the person has this ApoE4 gene, would that decrease the risk of MCI even if the person has the genetic risk? And similar studies we have undergoing analysis in this area.
Well, then the more we know, the better. It looks like keeping your brain active as well as some physical activity as we get older can help prevent cognitive impairment. So you exercise your brain, you exercise your body, and I guess keep your friends.
That's right.
Dr. Yonas Geda from the Mayo Clinic in Arizona, thanks so much for joining us.
You're welcome. Thank you very much for having me.